Today class, in this video we are going to talk about the liver syndromes. The liver locates in the lower jaw below the diaphragm. The eyes are the orifice of the liver. So the patient suffer from the liver problem may present with the eyes problem such as itching eyes, sore eyes, or red eyes. So when these manifestations begin to treat from the liver. The meridian, the liver meridian goes from the foot all the way up to the external genital area and then travels up to from the abdomen to the chest, all the way to the head. So because of the distribution of the meridian, the liver problem also can reflect in the external genital area as well as the chest. So when we study the symptoms, some symptoms you will see related to the liver meridian. That's why sometimes the patient will feel a pressed chest. That's because of the liver meridian. The functions of the liver mainly in categories into two functions. The first one is the liver governs the flow of qi. Because of the flow of qi also relating to the flow of the blood and water metabolisms. The flow of the qi also can promote digestive function of the spleen and stomach. The reason is because the function of the spleen and stomach also is from the function of the qi. That's why we call the spleen qi and stomach qi. Regulation of the emotions. So the emotions problem also will reflect in the liver, promoting the reproduction in humans. This is mainly related to the reproduction or fertility issues. The other reason also because of the liver meridian travels around the external genital area. So when you check your acupuncture and meridian textbook, you will see the distribution of the liver meridian. That's also why the liver related to the reproduction system very closely. The second function of the liver stores the blood. The liver stores the blood, it will store the liver qi. The reason is because the blood is the carrier of the qi. The liver can regulate the volume of the blood in the system. The liver can nourish the liver blood nourish the liver and eyes. The source of menstruation. So patients with liver problem, especially for liver blood deficiency, may present with problem in menstruation in ladies. Liver also can prevent bleeding. That's because the liver can store the blood. Also, the other function is because the qi regulation. Bleeding must be from the abnormal of qi movement, because the movement of the blood need the qi as well. So when you see something in, blood is in, something you can see, you also need to think about something yang, because yin and yang, they always stay together. Something you see as the blood, you need to think about the liver qi. That's something you don't see. Bleeding is the result of the liver qi. So from these functions, the disorder of the liver, you will see the manifestations mostly related to the emotions or mental activities. The digestive problem is because from the liver and the spleen, one's the wood, one's the earth. So that's the relationship from the 5 elements. Also can manifest on the blood problem, the nourishment of the blood. So we're going to see what exactly can happen in a liver disorder. The tears as the body fluids of the liver. So sometimes some patients will present with tearing. What kinds of tearing? When there's wind, when they feel the wind, the patient will tell you that they're tearing. The ligament problem also due to the liver. The eyes problem also you need to think about the liver. So for these problems, you can treat from the liver. The first one, the liver blood deficiency. This syndrome manifests as the malnourishment of liver-related tissue and organs. The liver-related tissue and organs, such as the ligaments, the eyes, the orifice. The patient can feel, again, similar to the previous syndromes, we're going to separate them. The liver and the blood deficiency. So the patient will present with dizziness, blurred vision, visual deterioration, night blindness, numbness of the limbs, tremor of the hands and feet. Why the patient will have this symptom? Joints, muscles, skins, insomnia. Why the patient will have insomnia? And the dream disturb. The dream disturb sleeping, scanty menstruation. So that's from the blood deficiency. Even amenorrhea, there even no menstruation. The tongue is pale, the face is pale. White coating, that's from the blood deficiency. And why menstruation? That's because the liver problem. But here, the question is, these two manifestations, tremor and insomnia and dream disturbed sleep. The reason for the insomnia and dream disturbed sleep, you will see these are actually the manifestations of the heart. The heart, especially the heart blood deficiency or the heart insufficiency. The liver blood deficiency. So you can think about in the body, we got the liver blood deficiency, and the blood of the body stores in the liver, which means it's very similar to the rivers. Different rivers comes to different area. There's a lake. All these rivers, the water goes to the lake. Now, the lake is a lack of water. You think in the rivers, these different rivers, we have a lot of waters. So the answer is obviously there also will be lack of water in different rivers because you see in the lake. There's not enough water in the lake, so you can assume that In the different rivers, there's also lack of water. This is very similar. The liver, because the liver stores the blood. That's the lake. The liver got blood deficiency. We don't have enough blood in the liver. So you can think about the heart blood or the blood in the other organs also won't have enough blood. That's why the patient may present with insomnia. All these symptoms that we have mentioned here is not the symptoms, is not the definite symptoms that the patient must have. It's the possible symptoms that the patient may present. So the insomnia during disturbed sleep are from the heart blood deficiency. Tremor of the hands and feet. When you see the word tremor, what do you think? Tremor is kind of a shaking of the hands and feet. So when you see the symptoms of tremors, that's shaking, something's moving, then you need to reflect. Now you should reflect to wind. So this is a situation, actually the wind already been generated from the blood deficiency. There's another syndrome that we talk about the internal wind from the liver specifically. So we're going to explain more from there. There's different wind, internal wind came from different situations, different conditions of the blood, different condition of the livers. So the patient may present with different conditions, but when you see the wind, you need to find some symptoms of some moving symptoms. That's the tremor, such as patient with Parkinson, the shaking. Then in Chinese medicine and in acupuncture theory, we think about the wind, the internal wind. In this syndrome, the liver blood deficiency, the key manifestation of the patient includes dizziness, blurred vision, numbness of limbs. And you see, these are quite common in blood deficiency symptoms. So from these, how do you know it's liver blood deficiency? Blurred vision. The something you see through is from your eyes. So that's the eyes problem. The liver yin deficiency. The liver yin deficiency, the patient may present with the liver problem and the yin deficiency. Now, when we mentioned about the yin deficiency, you should already know that's the feverish sensation in palms, soles, and chest. The 5 heart heat. Tidal fever, night sweat. So these are the symptoms of yin deficiency. The patient may present with the other symptoms that are related to the liver, such as blurred vision, dry eyes, dry mouth, dry throat, flushed cheek. So these are the yin deficiency related to liver. Yin deficiency will cause deficiency heat. That's why the patient can feel burning pain. And then why in the ribs area? That's because of the liver meridian distributes in the ribs area from the chest of both sides. The tongue is red because the yin deficiency will cause deficiency heat. The pulse is wiry, thready, and rapid. Thready is yin deficiency because you don't have enough fluid in the vessels. That's why it's very thin, thready. very rapid. That's because in deficiency, you got the deficiency heat in the body. Heat will result in a rapid pulse. So when we study the differentiations, when you see the symptoms, you need to think about the causes, the reason why. Then that's from our theory. The key manifestation: the patient may feel dizziness, dry eyes, insufficiency symptoms. Can the patient present with tremors? The reason is yes. The answer is yes. That's the moving from the tremor from the liver insufficiency and the liver blood deficiency will be slightly different. The reason is this deficiency, the insufficiency, is more likely to present as like slow moving and with deficiency heat. So the patient will present with the deficiency heat symptoms. The blood deficiency, the patient will present with the blood vision and the numbness in the limbs. That's because of the malnourishment of the blood in the extremities. The liver qi stagnation syndrome is one of the most common syndromes that we can see in our clinical practice. It manifests as the liver failing to maintain the free flow of qi. The causes may be related to the emotional depression because we got a lot of depression and especially the emotional issues now. That's why it is very common to see qi stagnation. Someone fights with their husbands or wives. Someone broke up with their boyfriends or girlfriends. They all result in depression. Someone have stressful work. It also cause emotional problem. So all these reasons will result in qi stagnation. That the patient can present manifested as these symptoms: depression, frequent sighing. After sighing, they feel better. Distension and fullness, the pain, the nature of the pain, distending pain, fullness of feeling. The reason is because in a pathway, it's supposed to move smoothly, goes in and out. But now, because of the stagnation, something blocked by the acid. So now it still goes qi goes in. So after a while, the wall of this container of this pathway will have more pressure. That's why it presents as distension or fullness. That's because of the pressure on the wall got more pressure. Migratory pain. That's also because qi is something invisible. They can move. In the chest, ribs area. That's because of the liver meridian distributes at the chest and ribs area. Lower and lateral abdomen. So when we study the meridian, you will see these areas are all where the liver and gallbladder meridian travels. You also can refer back to the basic theory we have introduced briefly of the meridian distribution. Some patients also may present with breast pain, especially ladies, before their period, a few days or even 1 week before their period. Some of them they can feel breast pain or pressure in the breast. That's because of excess qi movement in the liver meridian, and the liver meridian travels through the breast. That's why they can experience this kind of feeling. Dysmenorrhea, irregular menstruation. These are something related to the uterus, and this is also related to the reproduction system, the menstruation. The reason is also from the liver meridian travels around the external genital area. So from the liver qi stagnation, firstly, the patient won't feel happy, emotional depression. So they are either sad or they feel angry, irritation. Distending pain in the chest, ribs area, lower abdomen. So the nature of the pain is distending. In ladies, they might have irregular menstruation. Some patients also may present with infertilities. That's from the result from irregular menstruation due to the liver qi stagnation. So that's how to treat this kinds of infertilities. When we study the therapeutics, you will know that we got different treatments for the same problem. We got different treatments for the same infertilities. The reason is because the infertilities might due to the liver qi stagnation, might due to the liver blood deficiency. It also can be the result of the liver and kidney deficiency. So if the patient presents with liver qi stagnation, for instance, they fight with their husbands every day, and then the lady got infertilities, or the young couple recently married, and the mother-in-law always always mentions that you have to conceive, you have to have a boy. So this emotional problem not has to be depression, it can be stress. It can result in liver qi stagnation. That's why the lady develop into infertilities. That's from the liver qi stagnation. In this kind of problem, in this kind of situation, we're going to we're going to use the treatment to regulate the qi movement. Upflaming of liver fire. The upflaming of liver fire, this is actually the direct translation. What we focus on is the liver fire. There's no all flames from the fire are up. So all flames moving up. There's no flame facing down. The reason why we use upflaming, we just because this is the direct translation, just because we want to emphasize that the manifestations happens is mostly at the upper part of the body, because the liver is in the lower jaw, in the abdomen below the diaphragm, but the manifestations is on top of the body. That's because the fire from here, the flame is facing up. So let's see the manifestations. The patient may present with dizziness, distending headache. This is also because of the liver meridian. Redness, red face, red eyes. That's because of the orifice, restlessness, dry mouth, bitter taste. Bitter taste is very important for liver fire. And also this taste, you need to ask about the taste from the bitter taste in the early morning or in the afternoon, because this can reflect different problems. The one in the early morning made from the liver fire. The bitter taste in the afternoon made from the stomach heat. So that's the bitter taste. Bitter taste in the morning. Tinnitus. Restlessness. That's from an irritation. That's from the liver fire affecting the heart, cause the heart fire. Sudden deafness. Insomnia and nightmare, also from the heart fire. Burning pain in the ribs area. Sudden death is because of the fire cause qi blockage. Yellow coating is due to the fire. The fire results in the fire. The liver fire is the other words is the liver heat. The yellow color is the color of the heat. The pulse is wiry and rapid. The rapid also due to the heat. So the key manifestations are headache, tinnitus, pain in the ribs area, and excessive heat symptoms. This patient also can manifest as very bad temper. They feel angry or very easily. Hyperactive of liver yang. This actually due to the liver yin, so the hyperactive liver yang. In other words, that's the term we used before of liver deficiency heat. Where does the deficiency heat come from? That's from the yin deficiency. It can be the liver or kidney. So the deficiency heat we also call the hyperactive yang. Hyperactive means too active, liver yang. When you see here excess, this excess, it means the relatively excess, because this syndrome is due to yin deficiency. Due to yin deficiency, you can imagine that the liver yang won't be excess. That the excess is actually compared with the deficiency. So in this situation, the patient have yin deficiency. In this situation, you will be like this. That's the yin and yang. That's in the normal level. The yin and yang are balanced. Now we got yin deficiency. We don't have enough yin. So the hyperactive yang, that's compared with this yin. We got excess yang here. But this yang is actually normal, because this is the normal level. There's another excess yang or excess heat due to the situation of excess yang. So you can see the yang is much more than the normal level. So you need to be careful here, the term excess yang. The excess yang also deficiency, also here, because this is in a deficiency syndrome. The reason why we need to be careful in this term. It's because for hyperactive young, the treatments, hyperactive young, the treatments, we're going to focus on how to recover the yin. So we're going to focus on how to recover these parts of deficiency. We want to use the treatments, either herbal medicine or acupuncture points, to tonify these parts of yin. We don't care about the heat, or we only use something to reduce slightly the heat. The condition of the excess yang, if the patient have excess yang here, the treatment will be very different. We're going to use the herbal medicine to reduce the excess heat. You see, these two treatments are very different. One is tonify the yin, one is to reduce the yang. This one is the deficiency syndrome. This one is the excess syndrome. So we need to be clear this syndrome with the other excess syndrome. The manifestations here, the patient can present with vertigo, tinnitus, distension, eyes and head. That's because of the meridian travels there. Insomnia during disturbed sleep, affecting the heart. Hyperactive yang, although it is a deficiency yang, it also heat. So when you study the hyperactive yang, you can compare with the upflaming of liver fire. These two are heat. One is excess heat, the other one is deficiency heat. The patient may present with insomnia during disturbed sleeping. The treatment will be very different. The tongue is dry because of the heat, red because of yin deficiency causes deficiency heat, scanty coating, that's because of yin deficiency. So the key manifestation, the patient may have all these manifestations due to the kidney, due to the liver, and then the soreness and weakness in the waist. That's the manifestation in the kidney, because the yin deficiency can be both the liver and kidney. We actually cannot separate them very clearly. So these are the manifestations of hyperactive yang. In this video, we have introduced some common symptoms of the liver disorder. In the next video, we are going to study the internal wind due to the liver disorder. How many internal wind does we have mentioned in the basic theory, and what are the manifestations of different internal wind? How can we identify different internal wind? So this is something we're going to study in the next video. Thank you for your attention.